everyone.
Hi,
I'm Delia and I use she, her pronouns.
I'm married, she, her.
And Mari and I both started in fall of 2023 in the ICP program. I'm currently in my second semester of practicum,
I just started the practicum this summer.
and we are delighted to introduce you to some mindfulness activities that are great to do with children.
Yay.
So we'll be going over what is mindfulness, what's its therapeutic purpose, some key features of the practice, the age group that these practices target,
And then I will go over the raising exercise, preparation, procedure, and we will do a demonstration and then coming back to reflection questions and tips for practice.
and I'll be leading Mary in an ocean breathing exercise. Before we begin, I'm going to go over preparation, procedure, practice, and some ideas for how to integrate it. And then we'll do our demonstration.
Okay. So, what is the mindfulness is? Yeah, let's slow down and make this presentation more mindful. So, what is mindfulness? There are many ways to describe what it is. And for example, a state of consciousness characterized by receiving the present moment, pleasant or unpleasant, just as it is without either clinging or rejecting it. Awareness of one's internal state and surroundings, the practice of being aware of your body, mind, and the feelings in the present moment. I want to highlight the last one because it is more child friendly and suitable for this practice.
Yeah, now I want to go over some of the reasons why it's therapeutically useful. And Mary, you might chime in here and there or somewhere with some of the research data that backs this up.
Yeah,
So, mindfulness practices are helpful with developing emotional regulation, promoting sensory awareness, reducing impulsive behavior, increasing focus, enhancing relationships, and gives some relief from worrying about the past and the future.
yeah, I just want to share some study findings and some research found that mindfulness may be as effective as antidepressants in treating depression and preventing relapse. And a Stanford study found that guiding a group of children through just 1 minute of slow paced breathing in a regular setting can significantly lower the average psychological arousal. And then lastly, another study finds that the mindfulness-based training intervention improves ADHD symptoms and emotional regulations in school-aged children.
Amazing.
Yeah. Then key features of the practice is engaging. These exercises are accessible and engaging because they don't need any special materials or using familiar food items. So we can do it anytime and anywhere. And it's simple instruction, short duration, suitable for group and families. And they can be used as a daily or grounding ritual.
We recommend these practices for work with children who are as young as 3 years old, if it makes sense for that individual child, um, and all the way up through late adulthood, useful at all the ages.
Okay, now let's move to the raisin exercise. And what we need, of course, a raisin. And you can also use a chocolate chip, candy, or mints, or even gummies, something like that. And the procedures. It is just slowing down the process of eating a piece of raisin and then notice any sensation that arises while eating. So those are the procedures, steps, and holding and seeing, touching, smelling, placing and tasting, swallowing and following. Yeah, let's get to the demonstration. And then let's do that. Delia, are you ready to have a reason?
I have my raisins here. I'm gonna pick a
Okay,
really good one.
take a look. All right. Okay, first, holding. Place raisin in your palm or between your thumb and finger. Imagine you have never seen that before. And then take a time to really focus on it. Notice the color, size, and the shape of the raisin, where the light shines, any dark spot. Yeah, really take a look. And then touching. Feel the raisin's texture between your fingers. Close your eyes if you feel comfortable. Now smelling. Bring the raisin close to your nose and notice how it smells. As you do this, notice anything that may be happening in your mouth or stomach. Yum, yum, yum. Placing. Gently place your raisin in your mouth without chewing. Don't chew it yet. Take a few moments to focus on the sensation having it in your mouth and explore it with your tongue. The texture, flavors, and any other physical shift arise. Tasting. When you are ready, prepare to chew the raisin, how and where it needs to be chewed. Then, very consciously, take one or two bites and notice what happens. The texture and any changes that unfolds. And just keep chewing and notice the wave of flavor that may come and go. Don't swallow it yet. Just enjoy the raisin. And before swallowing, observe the urge to swallow as it arises. When you are ready, slowly swallow it down. And then feel the raisin moving down into your throat and the stomach. And how your whole body feels after you have completed this exercise. And if you're ready, then you can open your eyes. And then I'm gonna ask some questions. Well, what was it feel like? What did you notice when you look at it as if you never seen it before?
Um, just look kind of not that interesting, to be honest.
What about like a texture?
Yeah, when I felt it in my fingers, It was like a little bit dry and leathery feeling, but then when I mushed it, which felt kind of fun, it
Yeah.
was nice and gooey feeling
Yeah. What about smell?
inside.
Yeah.
So that was more pleasurable.
Yeah. Does it appealing to you, or you want to eat that kind of feeling, or you don't want to eat?
The texture I enjoyed.
Yeah.
The smell remind me of something else
Oh,
that makes me feel nauseous.
oh, oh,
Yeah, so I didn't enjoy smelling it.
oh no. I'm sorry.
Yeah, but once I got it in my mouth, that changed, and I like the feeling of it in my mouth. I thought it was kind of a strange texture because it's kind of dry and rough on the outside. But as soon as I bit it, it was like the second bite.
Hmm.
The first bite, not so much happened, a little bit of a release of a little bit of sugariness.
Yeah.
But the second bite was like my whole mouth filled with water and
Hmm.
it felt really sweet and tart at the
Hmm.
same time, kind of puckery and
Yeah.
also like pleasurable. Yeah.
Did you notice that the urge of a swallowing?
Yeah. I After I'd chewed it a few times or for a little while, I noticed that when you mentioned swallowing, I just swallowed it right away. And then you were like, before you swallow it. And I was like, well, it's a little late for that.
Sorry.
Yeah.
Okay. It's interesting. And yeah. Well, is there anything difficult to notice or, stay aware of? Anything?
I guess something that's interesting about the process was like that I definitely have a bad association with the smell.
Oh.
Um, but and usually there's such a connection between smell and taste,
Hmm.
but I was still able to like enjoy eating it. Um, so just the idea that you could have like these real different experiences in quick succession, like,
Yeah.
I don't really like that, to, oh, that's kind of interesting, to, sweet,
Yeah. Uh-huh.
like, yeah, just noticing how quickly you could move from one feeling state to another one was interesting.
Okay.
Hmm.
We, if you want to do it again, what would you use instead? Would you like to try to, raisin one more time, or what do you like? What you might like?
You
So
know
far.
what might be fun is one of those like little black licorice flavored candies that has little pink and white like uh, candy on the outside. Do you know what I'm talking about?
Mm-hmm.
Because that seems like the texture would be really interesting on the
Oh.
outside. And then I personally like black licorice, but yeah, or a dried apricot
Oh.
maybe could be good. Yeah.
Yeah. Yeah. So we can try something like that.
Hmm.
Yeah. Okay, great. And then what do you feel? Do you feel any difference before and after this exercise?
I felt a little tingliness in my arms from the mixture of sweetness and tartness.
Oh.
Um, but I also felt kind of calm because you were
Mm.
leading me through it in like a very slow way. So I like that spacious feeling of being slowed down.
Yeah, that's really slow to
Hmm.
eat one piece of a raisin.
Hmm.
Yeah. Right. Anything else you would like to add?
I think that's it.
Okay, great. All right. And then, yeah, let's go back to the questions. Yeah, those are the questions that we come up with. And then, yeah, I picked some of them. Yeah. Did you notice there anything new or like unexpected? Or something like this. Okay, let's move to the tips for practice. Gently guide the children to slow down and pay attention to what they are doing. Encourage reflection and validate their experiences. Repeat the practice regularly so that the mindfulness becomes a usable skill. Invite them to try it at home with their parents or maybe family members.
And now we're going to try the ocean breathing exercise. Mari, if you would move us along, I'll just quickly go over the elements involved. So you're not going to need any materials, which makes it nice and portable. You can pretty much do this anywhere and anytime.
Yeah, great.
And to prepare today, or when you're working with a child client, you're you can just invite the child to sit comfortably, or they can also lie down if that feels better for them. And they can close their eyes if that's comfortable for them, or if that doesn't feel so good, maybe there's a beloved stuffed animal or a nice plant in the room or something that they can just relax their eyes on. All it involves is breathing in through the nose and out through the mouth while making a pronounced sound like the whoosh of waves. Um, and so the therapist can start off by demonstrating what it sounds like and looks like. And then the child can follow along and then give it a try.
Great.
When the child has a hang of it, I let them know that I'm going to set a timer for 1 minute and we're going to do it together.
Great.
Once you finish the minute, um, you can ask the child how it felt to use the ocean breathing and talk about times when it might be useful for them if they think they'd like to ever try it outside of a therapy session. You ready to give it a go, Mary?
Sure. Okay, I'm gonna
Okay.
stop the sharing the screen.
Hmm. So, how's that chair you're sitting in? Does it feel comfortable?
Yeah, let me see. Yes. If
Yeah.
I lie down, I'm gonna be disappear.
Okay. All right, great. So, I'll just invite you to if you need to shake out your arms or your shoulders or
That's
move
good.
your head from side to side or do anything in your body to help you get out a little bit of extra energy, maybe so that you can feel a little bit more settled in your chair. And then once you're seated, if your feet are touching the ground, it might feel nice to place both of your feet solidly on the ground. It might feel good to rest your hands in your lap or just find a way to sit that really encourages your own comfort. You feeling comfortable?
Yes.
Great.
Yes. Yes.
So, um, you have the option to close your eyes if that feels good, or just relax your eyes and lower your gaze. Great. I'm going to start this breathing, and I'm going to be breathing in through my nose and exhaling through my mouth. And I'm going to be trying to make it sound like the waves of an ocean. So I'm going to breathe kind of loudly. You're definitely going to hear. And after you hear me do it a couple times, I want to invite you to give it a try yourself.
Okay.
Ready?
Yes.
Okay, great. I'm going to begin. Great job, Mary. Keep going with it. And I'm going to set the timer for 1 minute and I'm going to join you. And we're just going to make sounds of beautiful rolling waves. You're doing great, Mary. Yeah, just a few more breaths. Let's really hear those beautiful waves. In, out.
Oh, nice.
Great job. How do you feel?
That was nice. And then I visualized that I wave and I use the hands and yeah, the wave sound really helps to go, to get the rhythm of the breathing, and then also the visualizing it, all things coming together. Yeah, it really helps to relax. Yeah.
Yeah. Did you notice any sensations inside of your body?
Well, actually, at one point, it was a little bit of a too much, too
Hmm.
deep doing it, and a little start feeling lightheaded.
Mm.
But then I just adjust a little bit. Yeah. So
Yeah.
actually,
When
feels
you
better.
felt, yeah, when you felt lightheaded, did you have any like emotions related to that? Did that feel scary?
Yeah, a little bit of scary. This is not a good. Yeah,
Yeah.
I don't want to faint. It
Yeah.
wasn't that bad, but yeah,
Hmm.
so I just try to come back.
Yeah. Well, what's so great is that you found a solution right there in the moment. Just breathe a little bit more gently. And so you made a modification that worked really great for you.
Mm. Yeah,
Yeah.
yeah.
Good job. Do you think that that's something that you would ever want to do
Oh,
anytime
anytime.
in
Yeah,
your life?
yeah, it doesn't cost anything. It
No.
just have to, there's a have to, yeah, I can just breathing anytime and it will be definitely helpful before and after seeing a client or
Hmm.
any time that, yeah, I need to relax or need grounded. Yes. Yep.
Yeah. Yeah. Those are such great times to use it. Also, like if there's something stressful coming up, like an exam, or if you're having like a conflict with someone where you're not feeling
Mm.
really good about what they said to you, or you're not feeling like you got to say everything you needed to say, you know, sometimes you're just walking around with some stuck energy and it feels good to just
Yeah.
release it and be in the
Right.
present moment.
And
Yeah.
then you help me to put both feet on the ground before starting. That really helps too. Yeah.
Hmm.
Feel more grounded. Yep.
Yeah. Great. All right. Well, thank you so much for giving that a go.
Yeah. Should we go back?
Yeah. And thanks so much for watching this presentation, and we hope that you'll go check these two exercises out as well as one more.
Yeah. Yeah, we found these exercises from the therapistaid.com, which was actually one of the resources provided by this class to the class by Dr. K. Ta-da. Thank you.
We hope your nervous system has a great day.
All right. Those are the references. Thank
Thanks for
you.
watching, everyone.